Alrighty, welcome to episode 4, the last episode for today. We're going to be talking about the foot. So in the first layer of the foot, we have our abductor hallucis, abductor hallucis. The proximal attachment for the abductor hallucis is the medial tubercle of the tuberosity of the calcaneus, the flexor retinaculum, and the plantar aponeurosis. The distal attachment will be the medial side of the base of the proximal phalanx of the first digit. The innervation will be our medial plantar nerve, S2, S3. The blood supply will be our medial plantar artery, and the action is that it abducts the first digit, flexes the first digit, which is the big toe. Next is our flexor digitorum brevis, also in the first layer. The proximal attachment will be the medial tubercle of the tuberosity of the calcaneus, the plantar aponeurosis, and the intermuscular septa. The distal attachment will be both sides of the middle phalanges of the lateral 4 digits. The innervation will be the medial plantar nerve, S2, S3, and the blood supply will be the medial plantar artery and the lateral plantar artery. The action is that it flexes the lateral 4 digits. Also on the first layer, we have our abductor digiti minimi. The proximal attachment will be the medial and lateral tubercle of the tuberosity of the calcaneus, plantar aponeurosis, and the intermuscular septa. The distal attachment is the lateral side of the base of the proximal phalanx of the 5th digit. The innervation will be our lateral plantar nerve, S2, S3. The arterial blood supply will be the lateral plantar artery, and the action is that it abducts the little toe and flexes the little toe. For our second layer, we have our quadratus plantae. For the proximal attachment, it'll be the medial surface and lateral margin of the plantar surface of the calcaneus. For the distal attachment, it'll be the posterior lateral margin of the tendon of flexor digitorum longus. For the innervation, it'll be the lateral plantar nerve, S2, S3, and for the arterial blood supply, it'll be the posterior tibial artery. For the action, it'll be assists flexor digitorum longus in flexing the 4 digits. Also in the second layer, we have our lumbricals. The proximal attachment of the lumbricals will be the tendons of flexor digitorum longus. The distal attachment will be the medial aspect of expansion over the lateral 4 digits. The innervation will be the medial plantar nerve and the lateral plantar nerve, both S2, S3. The arterial blood supply will be the medial plantar artery and the lateral plantar artery. The action is that it flexes proximal phalanges, extends middle and distal phalanges of the lateral 4 digits. Moving on to our third layer, we have the flexor hallucis brevis. The proximal attachment is the plantar surface of cuboid and lateral cuneiform. The distal attachment is both sides of the base of the proximal phalanx of the first digit. The innervation will be the medial plantar nerve, S2, S3. The arterial blood supply will be the medial plantar artery, and the action will be that it flexes proximal phalanges of the first digit. Next, we have our adductor, ADD, hallucis, adductor hallucis. The proximal attachment will be the oblique head. The proximal attachment of the oblique head of the adductor hallucis is the base of metatarsals 2 through 4. For the transverse head, it is the plantar ligament of the MTP joint. For the distal attachment of the adductor hallucis, it'll be the tendon of both heads attached to the lateral sides of the base of the proximal phalanx of the first digit. The innervation will be the superficial branch of the lateral plantar nerve, S2, S3. The blood supply will be the plantar metatarsal arteries. The action is that it adducts the first digit and assists in transverse arch of the foot of the metatarsal medially. Also in the third layer, we have our flexor digiti minimi brevis. The proximal attachment is the base of the fifth metatarsal. The distal attachment is the base of the proximal phalange of the fifth digit. The innervation will be the superficial branch of the lateral plantar nerve, S2, S3. The blood supply will be the lateral plantar artery. The action is that it flexes the proximal phalanx of the fifth digit. Now on to our fourth layer. We have our plantar interosseous. The proximal attachment is the plantar aspect of the medial sides of the shaft of metatarsals 2 through 3. Metatarsals 3 through 5. So again, the proximal attachment is the plantar aspect of the medial surface of the shaft of metatarsals 3 through 5. The distal attachment will be the medial sides of the bases of the phalanges of 3 through 5 digits. The innervation will be the lateral plantar nerve, S2, S3. The blood supply will be the plantar artery and the dorsal metatarsal artery. The action is that it adducts digits 2 through 4, flexes the MTP joint, also known as PAD. Next, we have our dorsal interosseous. The proximal attachment is the adjacent side of the shaft of metatarsals 1 through 5. The distal is going to be metatarsal. The distal attachment will be the first medial sides of the proximal phalanges of the second digit, and then the second through the fourth will be the lateral side of the second through fourth digits. The innervation will be the lateral plantar nerve, S2, S3, and the blood supply will be the arcuate artery, the dorsal metatarsal artery, the plantar metatarsal artery. The action is that it abducts digits 2 through 4 and flexes the MTP joints, also known as DAB. The final layer is going to be the dorsal surface of the foot. In that, we have the extensor digitorum brevis. The proximal attachment will be the calcaneus, the interosseous talocalcaneal ligament, the stem of the inferior extensor retinaculum. The distal attachment will be the long extensor tendon of 4 medial digits. The innervation will be the deep fibular nerve, L5 or S1. The blood supply will be the fibular artery and the anterior tibial artery. The action will be that it aids extensor hallucis longus in extending the 4 medial toes at the MTP joints and the IP joints. Last but not least, we have extensor hallucis brevis. The proximal attachment is the calcaneus, interosseous talocalcaneal ligament, the stem of the inferior extensor retinaculum. The distal attachment is the dorsal aspect of the base of the proximal phalanx of the great toe. The innervation is the deep fibular nerve, L5 or S1. The blood supply is the the blood supply is the dorsal pedal artery. The action is that it aids extensor hallucis longus in extending the big toe at the MTP joints. And that's going to be it.